This is a comment that somebody sent in to me. A friend just had a cyst on her clitoris. I went to get it checked and they told her it was a tumor and cancerous. It was removed and 2 stitches. That this person is asking is, I'm not sure how they could tell her that same day it was cancerous. They sent it away after removing it, so not sure what the results will be. Thank you so much for sending in this question. I understand the concerns that you have here. They cannot give a definitive diagnosis. That is the reason, obviously, that she's gone to have it removed, and then they've sent it off for testing. So this will be in the laboratory, in the hospital laboratory. They're going to be looking at the tissue and the cell, whatever fluid that they got out of it. They're going to be exploring it to determine whether it has any features of cancer, to give you a confirmatory diagnosis. Because I want us to talk about vulval lumps, to explain to you that vulval lumps are very, very common, ladies, and they can cause a lot of anxiety. And it's important that any new lump is checked out by your doctor, especially if it's persisting more than a couple of days. So that might be 2 or 3 days, or if it's getting bigger, it has other symptoms like pain, or there's a discharge, it's hot, and so on. Most of the time, they're benign. And when I say benign, they're not cancerous. They're not going to spread and invade to other tissues and lead to loss of life. Vulval cancer is rare. It's important that it's picked up early so that you can get the best treatment available. One of the more common types of, should we say, benign lumps, and I say that advisedly because I know many, many women suffer from what we call baffling cyst or abscesses. And baffling cyst is one example of a vulval lump that is, like we say, is benign. Where of something else that could happen in the vulval area that some people can experience is called an ingrown hair. Ingrown hair is basically an inflammation of the follicle or folliculitis. So this is very common for those of us who shave or wax or pluck. The hair curls back into the skin and then it creates a small red lump, a tender bump. It might look like a pimple. Sometimes it could look as if it's filled with pus as well. There are other types of cysts called sebaceous cysts, which are sort of very small and they grow very slowly. They are not cancer. Like I said, these are benign causes. They're sort of filled with oil. So these are skin gland kind of cysts. They're usually painless. There are potentially a number of things that could cause a lump in the vulva. If it's something that is getting bigger, not going away after a couple of days, it's time to speak to your doctor. So a vulval cancer or a lump that could be cancer in the vulva, we're talking about something that is maybe sore, so it might be tender, it may not go away after a period of time, it might be getting bigger, it might be very itchy, it might bleed when you rub at it, and it might just open up and just weep. When I say weep, that's bringing out a bit of fluid or pus, and it doesn't get better. It is important to seek medical advice if at all you have concerns about this. Thank you.